On this episode,
pugs do unfortunately have higher anaesthetic risk, so we just need to watch it quite closely. If Linda continues to not breathe by herself, then we need to intervene. Come on, Linda, you can do it.
What it could mean is that there is something behind the eye pushing it out. What we need to do is remove the eyeball itself. Okay, let's go fishing. Oh dear, I'm worried about what that is.
but first,
42.2 degrees C.
He is red hot. Heat stroke is life-threatening. It can cause our organs to shut down, which is a scary thought.
I know. Good boy.
in Northern Yorkshire, an emergency case has just been rushed in for Louisa, chocolate Labrador Benson.
Chocolate Labrador.
The owner's been playing around with him in the park and he's collapsed and he's off his back legs.
The temperature is 42.2 degrees C, which is alarmingly high. That can actually be impacting his organs, his brain. He's potentially be seizuring.
Benson's been running around like a lunatic with another puppy, and he's just got himself so hot and worked up that he's actually suffering from heat stroke.
I know.
Waiting outside, Benson's owner Sharon is sick with worry.
I had a chocolate Labrador for 13 and a half years and he died last May. It's like losing a family member, and it's given me a fear of losing my new dog, just really upsetting. So, losing another one is like a heartbreak, and I don't want to do that, so hopefully he's going to be all right.
Give him a little drink. Good boy.
Heat stroke is life-threatening because when the temperature rises within the body, it can cause our organs to shut down, so it's really, really dangerous. We have had cases where we can't save them, or they've already come to us and they're dead, which is a scary thought.
We need to get him cooled, and then we'll try and see if we can keep his temperature nice and stable.
So cute.
In London, anxious owner Suzanne is returning to Scott's Isleworth practice with adored guinea pig Nugget.
It's just that eye, look at it. It looks like a fish eye, doesn't it? It looks like a sort of cod. It's a bit crusty around there where I've been putting the drops in.
Last week, after examining Nugget's bulging eye, Scott prescribed medicated eye drops, hoping they might help fix the problem.
I can't see much improvement with that, with Nugget's eye. It's a bit scary. We'll have to see what happens today.
Poor little pig. So cute.
Hi, Suzanne.
Oh, hi, Scott.
Nugget. Hello, you. You're looking very warm and cosy in there. All right.
Best place for him.
Do you want to bring
Okay,
him
I'll
in?
bring him in, yeah.
Yeah,
Okay.
come on then, let's go. Right, so...
Right, take a look at that.
Yes, how you been getting on with those drops?
Yeah, he's been fine. He hasn't really complained about anything. He seems okay.
Yeah, just
But,
holding him around the bum there, just sort of support him like that. That's lovely. So, yeah, I mean, he still kind of looks like he's looking at something, doesn't he, up in the sky? I must say I've never seen an eye look quite as prominent in a guinea pig as this. Poor piggy. There's a couple of ways that we can determine if an eye is functional or not. First, we use what's called a menace reflex, which is basically kind of almost fake poking the guinea pig in the eye. And if you see a finger coming towards your eye, you will close your eye to protect yourself.
Yeah, you can't. That other eye is definitely, you can definitely see.
Functional, yeah. In this case, this guinea pig wasn't flinching when my finger was going towards it, so it shows that the eye probably does not have any vision. I'm gonna have a little look in the eye.
Yeah. Oh, he's watching the way you're going with his... Look, he's turning over. Oh, I'll pick him up again. Oh, you poor thing.
Yeah.
This is a bit clingy, look at this.
Buddy.
I've never seen him so clingy.
On this side, we have an eye where the pupil closes down when it's exposed to light, which
Okay.
it does because it protects the retina at the back of the eye. On this eye, however,
It's
the
not doing
pupil
that.
doesn't move, no. So what it could mean is that there is something behind the eye pushing it out, and that could be something not very nice. So that's the bit that we
my
need to
God.
investigate today.
Right.
But what I think we need to do is, because it's not actually
Look.
improving, oh, he loves you, doesn't he? That's sweet. Because it isn't improving and it's a kind of consistent likelihood of discomfort, then it's a welfare issue to remain in place. So that's kind of where I think that it is best, sadly, that we do remove his eye.
Yes.
Clearly this eye is being pushed out of his head, whether we like it or not, and it will either become injured or cause him discomfort. So from a welfare perspective, unfortunately, the best decision is to have the eye removed.
Poor piggy.
Good girl, Linda.
In London, Jackie is bringing Linda in to see Michael, desperate for help for the little rescue pug.
Linda's a good girl, isn't she?
8-year-old Linda has had a serious skin issue ever since Jackie saved her from a puppy farm in Hungary.
Off to see the vet now, good girl. Linda has a skin fold issue where the fold above her nose is too thick. She's really struggled with it medically. She rubs her face, she's caused eye ulcers in her eyes from rubbing her face. Good girl.
Jackie's hoping Michael will have a solution to finally bring Linda some relief.
Morning, Jackie. Morning. Hi, gorgeous. Hey, Linda, how are you doing? Hey, how's she doing today?
She's great, yeah, she's good.
Hey, brilliant. Well, should we go inside? Have a chat?
Great.
Let's go.
Thank you.
Okay, so how's everything been? Because I know that last time we spoke, we discussed trying to manage the skin fold. What have you been doing to try and keep them clean?
So we've been using the pads,
Yeah.
and we've also been using the eardrops that you gave me, Michael.
Yeah, with the antibiotic.
With the
in it,
antibiotic, yeah.
Linda's got a condition called facial fold dermatitis. So basically this is something that pugs get quite often. And it's when there's so much extra skin on their face, you end up with painful, inflamed skin. It becomes really itchy. And in Linda's case, she keeps trying to paw at her face because of the irritation. Exactly, and you can see even though we're doing all of that every single day, that skin in there just looks so inflamed and moist, doesn't it? So let's just have a quick look at how deep these skin folds actually are. So I think the main problem that we're seeing is here between the nose and the forehead. And can you see that ulceration and that inflammation there?
Yeah.
So sometimes surgery is a permanent solution to this problem. The problem with facial fold dermatitis is that you have these layers and layers of skin. It becomes really moist and dirty inside there, and that's the perfect breeding ground for infection. So I basically decided there and then surgery is the best option. And we remove some extra skin to reduce the size of the skin fold, and you eliminate any possible infections from recurring.
So what would happen, Michael, if we didn't go ahead with the operation?
She would just have a lifetime of constant skin infections, constant irritation. And we know that sometimes it gets so bad with Linda that she really starts pawing at her face and rubbing her face. And that can lead to really dangerous eye ulcers. And there have been numerous pugs that have actually had to have their eyes removed. When deciding to go for surgery, there are several risks involved, especially with all the flat-faced dogs like Linda. Pugs do unfortunately have higher anesthetic risk, and that's just due to their inherent breathing issues. So we never go into this decision lightly. So basically the plan for today is to make an incision starting from that side there of the face, going all the way up above the nose and down to that side.
I'm quite nervous about the op today, only because she's a pug and the general anaesthetic is always a risk. So I am nervous.
And she'll be in good hands, okay?
Yeah.
We'll take good care of her.
Thank you, Michael.
Hey. And don't worry, Linda, after today you still have your modelling career. Yeah, you're going to be nice and pretty. We're going to get you on the cover of Vogue. Are you going to sit
You're in
with me?
good hands, aren't you? Oh, I love you, Linda.
Oh.
Love you, Linda.
Brilliant. We'll see you later on, Jackie.
Bye.
All right, take care.
Poor little eye.
At Scott's Isleworth practice in London, little guinea pig Nugget needs major surgery to remove his bulging eye.
So he'll have a kind of permanent wink, I'm afraid.
You're going to give him a little eye patch, aren't we?
He'll be a pirate guinea
He
pig.
is a pirate guinea pig.
Owner Suzanne is putting on a brave face, despite the drastic surgery.
I think it's quite horrific having an eye taken out because obviously it's not something that would normally happen to a person.
What we'll be doing is obviously removing the eye, and then I'll be able to look into the eye.
And if there is something
socket.
sinister, what will happen?
It depends what it is. It really depends what it is.
Can you treat something sinister?
In guinea pigs it is very challenging because in most cases the chemotherapy options are very limited. So we just have to really hope that that's not the case.
God, I hope not. Well, let's be positive.
Exactly.
And hopefully he'll be fine.
Yeah. So cute, cute little noises.
It is cute.
So maybe we'll pop him back in his little box.
Okay.
There we go. All right. So
okay.
pop him in. So say goodbye.
He's trying to kiss me.
He's trying to give you a kiss.
Oh, that's so cute. Be good and be safe.
Okay.
See you on the other side. Thanks a lot.
All right.
Okay,
See
right,
ya.
bye-bye.
Bye. Say bye, Mummy.
Bye. The best outcome would be that Nugget would be not in pain, and hopefully there's another couple of years left in him, hopefully.
So this is Nugget, and Nugget has quite a nugget of an eye. To think I'm going to take an eye away, it's the window to the soul, and you know it's what you look at in your pet adoringly. So to remove one is a big concept. No, you're very sweet. You've stopped squeaking now. Is it because Mummy's not here? All right, little piggy, here we go. There you go. I know. Oh, we're sorry.
Safely anaesthetising the 5-year-old will be the trickiest part of the surgery.
Unfortunately, I have had very sad situations where small creatures like guinea pigs just simply don't cope with the process of the anaesthetic. And they die before you even have a chance to perform surgery. So to anaesthetise an animal like this does come with significant risks. There are initial highs and lows where he's waking up suddenly. When we're clipping the nails, he can feel a little bit. So we're just navigating through that early part of the anaesthetic to make sure that it's not too deep that we potentially lose him, but not too light that he'll feel the procedure. So this can be a little bit of a tightrope walk. Poor piggy.
We need to get him cooled, and then we'll try and see if we can keep his temperature nice and stable.
In North Yorkshire, Louisa and her team are frantically trying to bring down Benson's temperature. The 9-month-old Labrador is suffering potentially fatal heat stroke.
We're going to kind of rapidly cool him. We'll stop before his temperature gets too low. 42.2 degrees C.
He is red hot. His temperature is 42.2 degrees going up, so a dog's temperature shouldn't exceed maybe 38.8 degrees Celsius.
As the nurses cool him down with cold water, Benson's owner Sharon worries she could lose the young dog she's fallen deeply in love with.
When I lost my other dog, the house was empty, I couldn't cope, so at Christmas time we found this other litter. We went to Norfolk and got him from Norfolk and then brought him home on New Year's Eve. He's grown like a big giant now. He's a massive 9-month-old Labrador and he's just my world.
So it's coming down, it's 41 degrees at the moment.
To everyone's relief, Benson's alarmingly high temperature is beginning to drop.
Yeah, so it's coming down nicely now, so we're about 40.5 degrees. He was 42.2 degrees Celsius when he came in here. When he came in, he was collapsed, he couldn't use his back legs, he was very weak. Luckily, Sharon, Benson's mum brought Benson to us straight away, so we can treat him, whereas, if we were left another hour or two, Benson potentially could have died. In the 10 years, I've seen 3 heat strokes here, so it's not as common here, but it does happen. We tend... No, I think you can stand, Louisa.
I think what we'll do is we'll see if he can stand up now.
Come on. Those legs. Yay! Good start.
So he came in not able to walk, and now he can, but We're not by any means out of the danger zone. He's still very hot. He'll need a lot of close monitoring. You're cheeky.
So basically the plan for today is to make an incision starting from that side there of the face, going all the way up over the...
At Michael's practice in London, Linda the pug is about to get a facelift to help relieve her aggravating skin condition.
And don't worry, Linda, after today you still have your modelling career. Yeah, you're going to be nice and pretty.
But the surgery is going to be risky.
Pugs do unfortunately have higher anaesthetic risk, and that's just due to their inherent breathing issues. Whenever we're relaxing the muscles due to the anaesthetic and sedation, everything can become a bit more clogged up, basically. So it's very important to be quite swift, get a patent airway and intubate as quickly as possible. Okay, there we go, we're in. And now that we've induced her, we just want to make sure that she starts breathing on her own. So this is a really important time for us to just make sure that she's in a stable anaesthetic, and then once we're happy, we can continue to the operating theatre. It can be a risky moment when you induce a pet for an anaesthetic, because you never know how they're going to react, basically. How's she doing?
No, not yet.
So we just need to watch her quite closely. Come on, Linda, you can do it. If Linda continues to not breathe, we have to think why this is happening, and sometimes that can be due to her reacting badly to the anaesthetic. Something could be going wrong inside, maybe to do with her heart or her lungs. Is her heart rate stable?
Yeah.
I think she might be taking some small breaths.
No, I think she's taking some very shallow ones, isn't she?
Okay. Linda's finally taken a breath on her own after a few minutes of quite tense monitoring, so we're both very relieved at this. And if she continues to breathe now, that means we can progress to the procedure.
Ready?
Yeah. Oh my gosh, this poor face. It's always quite tricky getting all the hairs and the nooks and crannies of these folds, but we basically have to try and remove as much as possible, because if you don't get rid of bacteria and then you make incisions into the skin, that bacteria can then get in there, and that's when you end up with nasty post-op infections.
After the initial scare with the anaesthetic,
Let's go, Linda.
Linda is at last ready to have the excess facial skin that's caused years of irritation and infection surgically removed.
Let's put on 5 milligrams per kilogram, so that'll be slightly higher. There are a few different things I need to take into consideration. If you take too much skin from Linda's face, I can end up causing tightness underneath the lower eyelids, and that can actually stop a dog from blinking. And if that happens, then we're in deep trouble. It can even lead to blindness. It's quite funny, when you look at her through this little drape, you wouldn't think that that's a dog, more like some wrinkly alien of some sort. Are you happy for me to start?
Yeah, you can start.
Brilliant. Gosh.
In London, Scott is trying to stabilise Guinea Pig Nugget so he can start his delicate eye removal surgery.
Challenge of just trying to keep them deep enough you can perform the surgery, but light enough that they stay alive. So it can be a little bit of a tightrope walk. Being a smaller creature, they are just a bit more delicate, but also they have a fast metabolic rate, so they can go deep and then they can go shallow with their anaesthetic as they process it quicker. That plane of anaesthetic is pretty good. Okay, all right, I'll get scrubbing. The surgery to remove an eye is called an enucleation, and basically we start by suturing together the eyelids. So we're just going to get going now. Just going to first of all close the eye, which is sad. It's sort of the last time I'll see the eye. It's sad. I always feel it's like the window to the soul, you know, but he has got another eye. It is functional, and this eye is causing him discomfort. Okay.
Do you think it's good enough, this anesthetic?
Yeah, it will be interesting to see what happens when I do my first cut, because that will tell us, won't it? Yes, there's just a little bit of tensing there. So we just got to 3.5, please. Okay, let's go. It is quite tricky, quite fiddly, but also relatively quick, simply because it's a smaller bit of anatomy than, say, for a cat or a dog. Just be quite delicate when I get to this position. Pulling on the optic nerve, and sometimes you can irreparably damage the ability of the animal to see. Then what we need to do is remove the entirety of the eyelid structure and the eyeball itself. Now it's going to come off. Oh dear, I'm worried about what that is.
You happy for me to start?
Yeah, you can start.
Brilliant.
In inner London, Michael is carefully cutting away excess skin from Linda's face to prevent ongoing infections that have made the pug's life a misery.
Okay, so that's going down there, and then there, and then the plan is to pull that down to the, there we go. It's quite a tricky surgery because there's so much loose skin and so many flaps in a very small area. The main thing I want to do here is make sure that Linda remains as beautiful as she was before the surgery, maybe even prettier, we'll see. And right now I'm about to remove the flap of skin from underneath the left eye. There we go. Things can get quite tricky when you're trying to cut away skin from this area because there are so many vessels and important structures around the eye as well. If you were to cut a facial nerve, you could then cause facial paralysis, for example.
As Michael reshapes Linda's face, Nurse Audrey is keeping a close watch on the 8-year-old's vital signs.
He's got slightly low blood pressure at the moment.
Okay. Blood pressure's a bit low, so what we're going to do is just give Linda a large amount of fluid in a very small amount of time, and that can increase the blood volume, and that increases the blood pressure. And the last thing you want is a dog to go under cardiac arrest while we've got an open wound in front of us.
Linda's blood pressure soon stabilizes, and Michael is hoping he can complete the life-changing facelift without any further complications.
It is starting to come away quite nicely, so I'm holding my breath, but things are looking good at the moment. And that is the last bit of skin. So I'm going to start stitching up. Nearly at the finish line here. Okay, that's it. So make sure that all the skin is nicely held together. Okay, brilliant. So the moment of truth, the unveiling of Linda's new face.
Right, that's all you're getting, just a little bit.
In northern England, Benson's raging temperature is now under control after a potentially fatal case of heat stroke.
I'm going to be checking his temperature, and when it's dropped to around 39 degrees, we'll then stop and let his body lower his temperature up by himself because he'll be wet and cool, and we'll have the aircon on to try and cool him down by himself.
Sit down.
Right.
Billy.
Right, I'll go and tell your mummy that you're okay.
Hey, sit down. Wait there. You cheeky.
Hello. So he's doing much better. His temperature has come down from 42.2 to now 38. So the normal temperature is about 38.5, 38.8. So we've cooled him down, he's had a nice bath, he's had something to eat.
The good news is a huge relief for Benson's devoted owner Sharon, who's been worried sick her much-loved Labrador might not make it.
But he's recovered, and as soon as he's cooled down, he was happy to walk and wag his tail, and we all got absolutely soaked. Yeah.
What a good boy you are, Anna. Oh, thank you. His temperature's completely normal now, so that's good news, isn't it, mister?
We seem to have got out of the danger zone. We've dropped his temperature and he's not had any seizures, so we seem to be a bit safer now. So the next thing is we need to get a blood sample because we know that overheating wreaks havoc on the internal organs. We know that they can go into organ failure.
There we go. Good boy.
Kidney, liver, all good? They're fine. So yeah, pleased with those?
So he's okay just to go home once
Yeah, so we can send him home.
So the blood test just showed that his organs were functioning absolutely fine. There's no changes there, so we've got nothing to worry about. Come on then. Temperature's down, bloods are clear. He's happy as a clown, wagging his tail. Come on, let's go. He's been a typical young Labrador and he's desperate to go home, so we're going to get him home.
Hello, hello, beautiful boy. Hello. Oh, he's loads better, isn't he?
Come on, you cheeky boy. Use my butter.
Oh, sorry. Oh, he's peed everywhere.
The frisky 9-year-old is clearly excited to see Mum Sharon.
Is this your departing gift to me? It is.
Yeah, I'm feeling relieved now that he's all right. At least they've got him sorted out, so we can get him better now. That's good.
All right, Buggerless, go on.
Well, thank you very much.
No worries, you take care.
Thank you very
See you
much.
later.
See you later.
Bye.
Bye-bye. All happy now? Yeah? Beautiful boy.
Oh dear.
In London, minutes into Guinea Pig Nugget's eye removal surgery, Scott has made a potentially devastating discovery.
Dear. I'm worried about what that is.
Is there a mass behind the eye?
Looks like it. As soon as I take the globe, the eyeball away, I immediately see something that I shouldn't, which is a large, white, fleshy structure. It isn't fat, it's a little bit thicker than that, and I am concerned about the possibility of it being cancer. Yes, there's not really any chemotherapy options for guinea pigs. So it does actually come out quite nicely. So there is so you can see it's almost as big as his eye. It's no surprise that the pressure that it produced at the back of his eye was leading to it popping out like it was. And I can see the fat pad that normally is there, and the tissue that I've removed is different from it. So I'm pretty certain that this is a tumour. All I can do is to try and remove the tumour in its entirety. And that's really tricky because of where it is. This is so close to his brain. I can't remove any more tissue than is absolutely necessary. So yeah, I mean, actually, I'm pretty satisfied that I've got all the tumour that I can see out. I'm now going to close up. I'm pretty happy with the result. I've removed absolutely every single thing that I can see, but unfortunately, even one cell that may have gone further in can then end up regrowing, but I've done the best I could. Okay, and that's that. Okay, so let's wake him up. The recovery process from anesthetics can be equally shocking for a small creature like that, so we're not out of the woods yet until he's moving around normally and eating. Hey? Yes, you're a bit piratey, but very handsome pirate. Hey, still beautiful. Yeah. Hi, baby.
So the moment of truth, the unveiling of Linda's new face. That is looking very nice.
In London, Michael has finished delicate skin removal surgery on rescue pug Linda.
I'm pretty happy with how that looks cosmetically. Nice and symmetrical. I can see that there's no more skin-to-skin contact, and that was the main issue in the first place. All in all, things are looking great and Linda looks beautiful.
Well, Linda.
Hello, good afternoon.
Oh, hello.
This is a really good sign. You know, she's had a very stable anesthetic, nothing that made our heart stop, or hers. And to see it like this is a very good sign, and she's breathing nicely as well.
Well done, sweetie.
Good girl. Good girl.
For owner Jackie, it's been an anxious wait, hoping her little girl is finally free from debilitating pain and constant infection.
So I've been really nervous the last couple of hours waiting for the call that, you know, the operation went smoothly, everything went well with the anaesthetic.
You excited to see your mom? Hey? Yes, you've been such a good girl.
Oh, hi Linda. Oh, look at you. You give mommy a kiss? Oh, brave girl.
I'm actually very pleased with how the surgery went. She did have a lot of loose skin. Okay, so what we did was remove just enough so that we can remove any skin-to-skin contact. So you can see here, no skin touches another partner. So that means that as things heal, we won't have any more infections. Do you like your haircut?
It's great, Michael. Oh.
It's always a great feeling when you see pets reunited with their owners. And in this case, you can see Linda is just so happy to be back with Jackie.
You look good, don't you?
Yes, you're going to be a beautiful dog.
You look great.
Hey, we'll get you modeling again in no time. Huh? Yes. Oh, is that nice? There we go. There. She likes these scratches. Eh? Hopefully plain sailing from here and she'll recover quickly.
Yeah.
Okay, Linda, have a good recovery.
Thanks so much,
No
Michael.
problem. I'll see you soon, okay?
Thank you very much.
Bye, Jackie. Right, take
Bye.
care.
Bye, Michael. I was so relieved when I picked up Linda. This is going to make a huge difference to her life. She doesn't have to have treatment anymore. She's going to be a happier dog. Good girl, Linda. Good girl.
At Scott's Isleworth practice in London, anxious owner Suzanne is eager to be reunited with her beloved guinea pig Nugget.
I just cleaned the guinea pig cage out, ready for Nugget's return. And yeah, just trying to not think about it actually.
Hi Suzanne, do you want to come
Hi.
through? It is always lovely to return an animal back to their loving owner. Nugget's been a brave boy. He'll be going home to lots of snuggles with Mum. There he is.
Oh my God. Oh, look at him.
There he is.
Oh my God, he looks so scary.
Do you think?
No, it's because you shaved his head.
It is quite funny seeing Suzanne's response, not so much focused on the incision line, the surgery, more on his haircut. But hey, the hair will grow back and he'll just look like he's winking all the time. Honestly, he will look just fine given a few weeks. The shaving's the least of his problems.
I know. What, you're going to tell me something bad?
Well, unfortunately there was a mass behind his eye,
Yeah.
I'm afraid. His eye and the mass are about the same size. Now, I'm pretty certain that it's not going to be something good, just simply because there is fat that lives behind the eye,
Yeah.
but I found the fat.
Okay.
This looks different.
Oh dear.
Yeah.
So have you taken that away?
I feel pretty confident that I have removed it all, but it is in the end a case of a lack of margin, which is where we take a section of healthy tissue. That's not possible.
Okay, so it'll come
I've
back,
taken away,
possibly.
it potentially could, yes, even just with a few cells it might
Oh, look at
regrow.
him. He's so sorry. Look at him.
Our job isn't always cuddling puppies and stroking kittens. Sometimes it is really hard and we have to give really unfortunate news, and I'm delivering the news that unfortunately he does seem to have a cancerous lump and he may not be around for much longer.
Guinea pig.
Yeah.
Who'd have them?
Well, you would, and you obviously love him.
I do love him. I do love him.
As a vet, we need to champion animal welfare, and in the case of Nugget, I've done exactly that. He'll be so much more comfortable no matter how long he lives for.
Well, at least he survived the operation.
He did.
He might not have, might he?
He did really well. He did really well under the anaesthetic.
Totally happy that he's had that. It could have been worse. It could have been worse. It could have been a lot worse. Oh, thank you.
Oh, you're welcome.
Thanks a lot.
I'm sorry for the bad
That's
news.
okay. Well,
He's done 5 years. Who knows how much longer?
he could be the world's longest guinea pig survivor.
He could.
Let's keep him going until he's about 15. Thank you very much.
You're so welcome.
Okay.
All right.
Thanks a lot.
All the best.
Okay, thank
See
you.
ya.
Bye.
Bye.
It's been a month since Michael performed skin removal surgery on pug Linda, and life has changed dramatically for the little rescue dog.
Good girl, Linda.
She no longer suffers from skin irritation and infection, and owner Jackie says she's now pain-free and much happier. And Louisa's emergency patient Benson has also made a full recovery after suffering near fatal heat stroke. The lively young dog is back to his frisky self, but is now enjoying less boisterous outings to the local park.
If you guys loved that video, great. Make sure you subscribe to our YouTube channel below. That way. That way.